How much will healthcare cost you in retirement? We're going to look at this calculator from Fidelity. Now, I'm a big, have a big critique of the Fidelity study that talks about the healthcare costs in retirement that everyone seems to cite as a way to fearmonger. I don't necessarily blame Fidelity for that. I just blame the whole entire industry as a whole for allowing it to seem as if healthcare costs are going to be your number one expense in retirement when we know it's just not true. Not even close. Not even close. But there is still expense. I mean, healthcare still costs money. Medicare Part B, Medicare Part D, Medicare Advantage, or your Medicare supplemental policies. No matter how you look at it, how you slice it or dice it, you're going to probably spend at least $300 a month for healthcare. That's fact. So it's not a small expense, but relative to other things, it's not that big. However, it could grow, and you need to be prepared for that. So Fidelity's got this wonderful tool, which we'll dive into, about how much it'll cost for retirement. While Medicare will pay for some of your costs, it doesn't cover everything. The average 65-year-old couple today will spend around $11,000 on healthcare in their first year of retirement. So let's see how they got that number. Our methodology, based on a hypothetical couple in 2018 with life expectancies that align with the Society of Actuaries, healthy annuitant rates with mortality improvement scales. Woo! Actual assets needed may be more or less depending on actual health status, resident where you live, and longevity. Estimate is net of taxes. Cost basis is assumed to equal market value. Estimate is calculated as the assets required today in a taxable account with an effective tax rate of 5% and asset allocation of 30%. Okay, but I mean, the Fidelity assumes individuals do not have employer-provided retiree health care coverage but do qualify for Medicare, original Medicare. All right, and that's just Part A and B. All right, so you don't pay anything for Part A. You've already paid for that during your HI part of your FICA. This calculation takes into account cost-sharing provisions such as deductible and coinsurance associated with Part A and B. It also considers Medicare Part D, which is prescription drugs and out-of-pocket costs, as well as certain services excluded by original Medicare. All right, so they're not showing a Medigap or a Medicare Advantage. So I don't get that. Hey, well, that's weird to me. So I don't. Why would? Okay. They only talk about original Medicare. So remember, original Medicare, Part A and Part B, and this whole thing was Bernie Sanders and all these people, Medicare for all. Original Medicare is still these huge gaps out there. I mean, you're still on the hook for 20% of the cost. I mean, let's be very clear there, which is why they have supplements or Medicare Advantages to give you an out-of-pocket limit on how much you have to pay. I mean, this is huge. In fact, I'm going to interview in about 2 weeks this lady named Danielle Howard out of Texas who does Health for Boomers, a pretty big Facebook page. I forgot what it's called. She interviewed me yesterday, as a matter of fact, so I'm going to interview her to talk about Medicare. She interviewed me to talk about retirement planning because a lot of her clients are scared crapless, pardon my French, and I try to alleviate some of that concern. And I'm going to turn around and interview her as well as about Medicare planning. But anyway, so if you're only using Part A and Part B, you have a significant out-of-pocket expense risk to you. So don't do that. Get Medigap, which is what I recommend, or Medicare Advantage if your budget's tight. So I don't get how they get this $11,000. That's odd to me. But anyway, let's dive into this. Let's get started. So we're going to click on this, and we're going to tell you about me. So I'm male, and I'm female. Okay. Oh, I'm male. Okay, gotcha. I'm male. I'm going to include my spouse partner, which is the beautiful. And then we're going to hit this guy here. We're going to say my current age is, I'll say 48. 48. And then my beautifuls is 44, right? 45, 44, 45. All right, she will be 45. Retirement age, we'll say 68 for both of us. All right, that works. Life, that works. Okay, cool. And then we're gonna estimate you and your spouse should be planning to save $387,000 for healthcare and retirement. First year retirement, this is the amount you'll need pay for 1 year of healthcare and retirement. $6,587 in this in today's dollars. Yep. All right. So between us, we're gonna need to pay what's that? $13,000 or so. Life, okay, but they don't. Man, I wish they would tell you what. Man, they don't tell you what it just. I mean, this. Oh man, I like it. I like it a lot. Actually, it doesn't. I wish it'd break it down for you a little bit more. because they're only saying the calculation takes into account cost sharing provisions such as deductible and co-insurances associated with Medicare A and B, and also considers Medicare D premiums as well as certain services excluded by original Medicare. It does not include health related expenses such as over the counter medications, dental services, and long term care. And they're assuming a 4.9% annual increase in healthcare costs. Yeah, I get that. See, but I don't agree with that. I mean, look, we can disagree all we want, but my issue is if it costs $500 a month, let's see, we take our Medicare A, our Medicare B, which is 135. So let's write this down. Your Medicare Part B is 135 in today's dollars. Remember, your Medicare Part D is 35, so that's 170. And I'm going to get Medigap, and I'm going to say my Medigap will be 120. All right, so that's 290. That's $290. That's $3,600. Now, some co-insurance will go in there presumably. So some currency, we'll just say $4,000. I still think it's $4,000 a year for my wife and me, as opposed to what they're saying. So I think they're. I don't know why they're not using Medigap and Medicare Advantage. But with that said, you got to save a lot of money to pay for healthcare and retirement. And now the question that comes to mind, the first thing that comes to mind is always, this is why I challenge the study. It's like, well, if I need that and I don't have that, I'm doomed, right? No, man, you're not. I mean, because how much does it cost for your housing? So let's just use this for an example. Healthcare represents, we'll just say 12% of your spending in retirement, which is spot on. We know this. And we'll even say 15%. Well, guess what represents 2.5 times more than that is your housing. So in that case, I need $709, almost $800,000 for housing. Healthcare transportation is a bigger expense than healthcare until you're about 85 years old. So I need another $400,000 for transportation. Food, never mind food. I mean, food's another one. It's a bigger expense than healthcare until you're 85 years old as well. So I need another $400,000 for food. And so this is what I don't like that. But I mean, I think it's still pretty cool. It's a pretty cool chart. And if we say retirement age, we'll say 65. And retirement age is 65. So, yeah, see, it doesn't, look at that. It changes it by, yeah. So here's a drop from if you get off before you hit Medicare. So retirement age is 65 is 65.87. It goes up by, I mean, that's that 5.9% increase. So it leaves a lot to be desired, but I still think it's pretty cool. Anyway, let's take your 3 retirement decisions here. Let's see what we got. All right, so we're going to go down right decisions, right time for Fidelity. So how do you prepare for retirement confidently? Making the right decisions at the right time about income and Social Security can help you more successful. Let's see, here's 3 retirement decisions to make. Each financial decision you make can have a big impact on when you retire, as well as on your expenses, income, and ultimately your lifestyle. Some of those decisions you'll make on your own, and others you'll want help with. You will see some guidelines to help. Okay, so let's see. Under 60 years old, your income savings, you'll need enough money for the lifestyle you want in retirement. Have you saved enough? Well, let's see what they say. 60, 62, pick a strategy. All right, let's click on this guy here, see what they say. I was born, I'm just going to say, we'll say one, oops. All right, let's see what they got here. And if I was born if I'm 60 years old, that means I was born in what, 2019 minus 60. I was born in 1959. Okay, let's see what we got. All right, waiting to claim. All right. See an example of monthly benefits. Okay, waiting to claim. 100% of my Ford. Okay, I get that. All right, so example of monthly. We'll say I'm a man. We'll say average or longer than average for my life expectancy. And we'll say I'm married. All right. Household income, we'll say that. And wait to claim. Why wait to claim? Because I'll make, okay, that's okay. Yeah, all right. I like the thing here, but it's not fantastic, but I like it. It helps. Anyway, so that's a Fidelity retirement calculator, or not retirement healthcare study with a couple other things. Actually, let's just see real quick. Let me guess what they're going to say here. They're going to say, oops, I need to go back. All right, so I guarantee they're going to say I need to save more. You ready? How old am I at today? 48. We'll say I'm 48 years old. How am I doing? Say I got $100,000 saved. There you go, saving. There you go, perfect. We'll say spending in retirement is going to be much less than now. So let's go down to here. Why does it not let me adjust? Huh. Let's not let me adjust. Why? Why does it not let me do it? Weird. Oh, you can say I can spend more, but they say I can't spend less. That is, why would they not let you spend less? That doesn't make sense. I got 100,000 saved. I don't. Why would they? Why would they say I can't spend less? All right, current salary is 50,000. I got 100,000 saved. I'll retire between the ages. I'm gonna make this smaller. I'll retire between the ages of 60 and 62 and 65. Okay, and your savings, your next move, factor in health. Okay, based on your inputs by age 50, consider I have 9 times my salary saved. You currently have 2 times, so you're behind. Okay. Okay, that's just weird. All right. Anyway, I like the calculator for Fidelity. I don't like this one so much, but anyway, hope this helps. We'll see you.